Well, there is a saying that the only thing constant is change. And when it comes to technology, that couldn't be more true. We live in a world that is constantly evolving with the next best, latest and greatest gadget. And nowhere is that more vital than in the healthcare industry. So we have Rob Montagnes, president of Licking Memorial Health Systems, here to tell us how their patients are benefiting from those new technologies. So good to see you again, Rob.
Happy Easter.
Happy Easter, happy Good Friday, all that stuff. We are talking about something very important, obviously, especially in your industry, the healthcare industry. So Licking Memorial Health Systems, I know you guys are always very early adopters of new technology. Why is that so important?
Well, speaking of early adopters and related to the History Month, little known fact, our organization was started in 1898 by 8 dynamic women in Licking County. So our organization owes a lot to those women to where we are today 118 years later. So I just gave a presentation to a historical society, so it fits right in to this month and your announcements. So
incredible.
But technology, we've come a long way since 1898, and I think it's important for us to be early adopters in that it helps us serve our community. And while we are not as big as some of the tertiary care centers, it doesn't mean we don't have the ability, certainly the clinical skills, and we're fortunate to have the financial foundation to purchase and implement some of these technologies very quickly.
And what is the basis, or really the reason, for some of the things that you've recently acquired as far as this?
I think most importantly, if it provides better patient care, we are very interested in adopting it. If it provides a better patient experience, we're interested in acquiring it. If it allows or helps our employees to do their jobs better or make their lives easier or better, we're interested in adopting it. And certainly if it makes us more efficient, that's always very helpful too. So we look at technology in helping in a variety of ways. If it can contribute in any of those areas, we want to make it a part of our business.
And you have done that with a couple of recent examples that we're going to talk about. And the first one, Early Sense. What exactly is that? Early
Sense is a really interesting and I think it's going to be a very innovative new technology in healthcare. We're one of the first to have it, not only in the state, but in the country. And it goes under the mattress and is in all of our beds, other than the ICU beds, which are a little more advanced just in general. But it basically provides our nurses and clinicians with regular respiratory readings and pulse readings, not just when they do their vitals every so often, but on a regular basis. And what it allows our clinicians is the ability to subtly detect changes in those respiratory rates or the pulses. And so they can much more quickly diagnose perhaps a significant onset of a disease. As an example, we've already had an example of a patient who became or was on the verge of becoming septic, which is a blood infection. Those are very hard to detect, have very difficult to detect symptoms or signs. We were able to get on that patient's symptoms much earlier with this technology and diagnose and treat that sepsis much earlier. So that's a very productive way to leverage this technology to better care for patients.
Absolutely. All right, the other one is the Hercules system. Sounds pretty strong.
Absolutely, and it really sounds like what it's used for. One of the most risky opportunities for injury for healthcare workers is back injuries related to moving patients. And certainly from a patient satisfaction perspective, one thing that contributes to dissatisfaction is being down in the bed, not being comfortable in the bed. And for a nurse perhaps to move a patient that maybe is larger in size can be a challenge. So Hercules is a system where just by pressing a button, the patient is moved back up to a proper, comfortable position. The nurse or tech is able to do that by him or herself without the assistance of other employees, and to do it without injuring potentially their back or injuring the patient.
So helping the patient and the staff.
Absolutely. It's a win-win.
All right, the last one, the Ready Doc, what is that?
Ready Doc would sound almost like it relates to physicians, but it doesn't. I sort of affectionately refer to it as the bug zapper, and that is, you know, we are out and about with our phones, with a lot of our technology. Certainly staff are moving from room to room with their stethoscopes. The Ready Doc allows you to put these items in basically a drawer, and through the use of ultraviolet light, it will take all of the germs and disinfect, if you will, the cell phone, the iPad, the stethoscope, whatever you put in that drawer. Doesn't damage any of the technology. And it doesn't clean it, so if it's actually got dirt on it, it's not going to clean it, but it will disinfect it from any of the germs. So certainly during flu season or as we have all these superbugs that can go from room to room or from device to patient, it allows us to make sure that the instruments, the items are clean and disinfected. We have about 15 that will be coming in. Some are already there, and it will be available both for the public to use as well as for our employees. So if you're going to see a loved one, maybe they just had a baby and you want to make sure when you see that infant you're not transmitting or tracking in any germs, you can use this ReadyDoc to make sure that all those germs are taken care of before you go in.
All right, Rob, 3 great examples. I'm sure there are many more we could talk about, but Licking Memorial Health Systems always staying ahead of the curve. So thank you.
Appreciate being here.